Hello again. Today we're going to talk about trouble swallowing. The term that's used in medical language is dysphagia, dysphagia. So this is a common problem we run into in gastroenterology, but it's not an uncommon problem in general, and especially I think in the hospital. So trouble swallowing is a large area of information, and I only cover a small amount in this video. But in the book that I wrote, there's quite a bit of information there. Again, not extensive, mostly targeting the lay person, but certainly can be helpful to many professionals. So a lot of people will come into the office and they may describe what they call as choking spells. And it's important to dissect in the history what exactly they're talking about. Are they talking about having trouble breathing, something getting caught in their airway, or are they talking about something getting caught in their esophagus or swallowing tube? So it's important to go through the history as far as that's concerned, and it's usually not too difficult to tell. As long as a person can breathe okay, it's not affecting their breathing at all, and they're not coughing, then that really speaks more for the esophagus or the swallowing tube. If, on the other hand, they're having trouble breathing, they're coughing, and they're struggling to breathe, that really you think of airway. So the most common, or one of the more common problems, is that people will get something stuck in their airway, and it can be life-threatening. And so the Heimlich maneuver was popularized, where you come in from behind the patient and put your hands just below the rib cage in the upper abdomen and forcefully pull towards you and apply pressure in one strong motion repeatedly to try and dislodge any food or obstruction of the airway. So a lot of people are aware of this, but they get confused when there's trouble swallowing and the person acts like they have an airway problem, but they really have something stuck in their esophagus. Well, then if they're breathing okay and they're talking, then you don't need to do a Heimlich, because sometimes that can cause a problem, especially if a food bolus is stuck in the esophagus. It's happened to a very sad elderly couple that I encountered, where the husband thought that he needed to do a Heimlich when the patient had an esophageal obstruction, and actually caused a tear in the esophagus and a subsequent disaster in his wife. And this was a very tragic story. Anyway, so it's that old saying, if all you have is a hammer, everything looks like a nail. So everybody knows about Heimlich, or a lot of people do, so everything looks like the person needs a Heimlich when they don't. So if the person is breathing okay, able to breathe, able to talk, as long as they can do that, then there's nothing absolutely that needs to be done at that particular moment. You can call emergency services and wait until trained professionals show up. Now, occasionally people will get something stuck at home when they're eating, and if that's in their airway, and if that happens, certainly a Heimlich can be done by a partner, or if you're alone, you can lean over a chair and see if the back of a chair will try to relieve the obstruction by applying pressure to your upper abdomen. Also, if something feels like it's in your airway, it's important not to breathe in at that point, but to put your chin down, lean over, and try to cough it up before breathing in. That way it'll have less of a chance to lodge in the upper airway. When you're having trouble And I think in general, it's a good idea if you're prone to aspirate liquid or food to keep your chin down when you swallow. You can fill your mouth, and you don't have to lean over until you actually, or put your chin down until you're actually going to swallow. So that's an important point. Now, the old way of trying to relieve an airway obstruction was to apply some blows to the back between the shoulder blades. This has gone into the past, and now we're recommending Heimlich. Now, it does work, however, and I had my wife's cousin developed an airway obstruction in the restaurant, and some blows to the back actually did work in her. So it could be that it would work. I'm going to move on to trouble swallowing. So people come into the office, they have trouble swallowing. It's important to figure out if they're having trouble swallowing with liquids or solids, or is it more of a problem with solids? So you try to figure this out. Mostly liquid trouble swallowing liquids is mostly what's called a motility problem. Has to do with coordination of the musculature and transferring of food bolus or liquid from the upper airway esophageal area to the lower esophageal area. And it's also called transfer dysphagia. So that implies there's a coordination problem, or there could be a very high stricture or narrowing problem in the upper esophagus with this. But usually it's a problem with motility. And some of those motility problems can be from acid reflux, so they may be fairly straightforward. If you're having solid food dysphagia, in other words, food is getting stuck, or sometimes pills get stuck, then that suggests a problem with narrowing or anatomical narrowing in the esophagus. So the more common problems there usually are esophageal stricture or scar tissue from acid reflux or other causes. But you always have to worry about esophageal cancer or some obstructive problem from a growth or a tumor in the esophagus, especially if it's progressive and especially if there's weight loss. You think along those lines. Now, there's a very important topic that's often forgotten to be taught in medical school or even subsequently in doctor's training, and that's called pill esophagitis. And I remember not long ago when I was practicing, and I had a patient come, a young woman come from the emergency room, and I think the doctors there were totally baffled, but it turned out she had pill esophagitis. So what happens there is a number of pills, different ones, and particular ones that are swallowed can become stuck in the esophagus and cause a localized ulceration or irritation and cause trouble swallowing. And the usual symptom is pain with swallowing, and pain with swallowing in the lower chest. It could be. This is a very specific symptom. It's called odynophagia, in other words, pain with swallowing. And it usually implies there's a problem in the particular area that the patient is pointing to. Now, patients can't always localize something that well, particularly when they point to the upper esophagus or base of the throat. But pointing in this area is fairly indicative of a localized problem there. So in terms of pill esophagitis, the usual setup is someone, particularly elderly person, who doesn't want to take much fluid at night, and usually this is a man with prostate problems. He'll take his pills right before he goes to bed, won't take very much fluid, and you're supposed to take at least 8 ounces of fluid and wait 30 minutes, but does none of that, takes a little bit of fluid and then lies down. Well, there's an area where the esophagus crosses the aortic arch, which is where a pill can hang up, or they can hang up down in the lower esophagus when you lie down immediately with very little fluid intake right after taking pills. So this can cause localized irritation and even ulceration in this area. Can be fairly specific findings on when you look down there with a scope, so-called kissing ulcers, where you have ulcers on both sides of the esophagus where something has gotten stuck there. So there are certain pills that can cause this, and there's a list of medications that can do this that are available, I think, online and certainly in textbooks. The number one that comes to mind is doxycycline, which is a type of tetracycline. And this one is probably the most common one that is occurring today. An older drug called quinidine was even more of a problem because it really didn't cause much symptoms until you had this really tight stricture. And I remember seeing a patient that we had to deal with that related to quinidine. But we're successful endoscopically, and he did not require surgery. But I had a case where there was a young woman who worked in a veterinarian's office, and she had like this. She said there was a bottle of like doxycycline, and when you got bitten or scratched with a pet, you went ahead and took that. Well, she was tired one day, and she took the pills and lied down immediately afterwards. And she had this awful pain when she swallowed down in this area. And usually these patients will have so much pain that they'll go to the emergency room because it's a very painful process. So that is called pill esophagitis. Now, the evaluation of patients with dysphagia, I would recommend, although you can do a barium swallow, which can be helpful, and that's where you swallow contrast media under x-ray guidance. That can be very helpful. And a lot of times they'll give a radio opaque pill, and you can see on x-ray if it hangs up somewhere. Usually that pill is about 13 millimeters. But endoscopically, it's also very helpful to look, and while you're doing endoscopy, you can do a dilation either with balloons through the scope or these what's called bougies or dilators, which are look like candles that are tapered on the end and have different sizes. So these can be quite helpful. So the usual thing would be acid reflux stricture. You do endoscopy, you see how bad the reflux changes are, whether there's lining changes there, do a dilation and get the patient started on medication. And you're talking PPI therapy, so usually Nexium or those types of medicine rather than Zantac, which is not as potent, not as effective. And also the newer drug may also be used, but that's usually reserved for patients that don't respond to PPI therapy or it's not effective. The new drug I'm talking about, Voquezna, is the name of it, the trade name. So at any rate, I think I'm going to go ahead and conclude that talk about dysphagia at this point in time. You should also note that endoscopy does have the advantage of being able to take biopsies of tissue through the scope. And that can be very revealing, especially in cases of cancer or a stricture that could be cancer, you're not sure. So with that, I'm going to go ahead and conclude this particular topic. Thank you.